time for On Point, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. For more than 2 years, the world has been battling the COVID-19 pandemic, and while things have improved significantly since the peak of the outbreak, there's still no end in sight.
That's right, but how are some countries still tackling the pandemic, and what else should we be concerned about moving forward? Well, for this, we are joined online with Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Professor Cowling, thank you very much for joining us this morning.
Good morning.
All right, so first and foremost, we want to start off in China there. What's the situation in Beijing and Shanghai like after all the testing and strict measures that were in place to tackle the virus? I do understand there's been some lifting of the measures as well.
Yeah, Shanghai's been locked down for 2 months now, and they've managed to get Omicron BA2 under control. It's a remarkable effort. They're now down to maybe double-digit cases per day, mostly or maybe even all in quarantine. That means the contact tracing's working, and they do have a plan to relax further, but I don't think they're going to be back to normal in the near-term future. I think there's still going to be quite a number of restrictions in Shanghai, particularly to prevent an immediate resurgence in community cases. And remember that the epidemics ended because of the control measures, not because of herd immunity, because of a lot of infections. So this could happen again anytime. In a month's time, in 2 months' time, in 3 months' time, they could have another outbreak requiring a shutdown of Shanghai. In Beijing, they acted much more quickly. So they've had much fewer cases and a much shorter lockdown. But unfortunately, yesterday, there was a person who didn't comply with the quarantine and then potentially has sparked another small community outbreak in Beijing. So some restrictions are coming back. So it's difficult, actually, in mainland China at the moment. There's other cities affected, and I think there's going to be a lot of disruption in the remainder of this year with outbreaks here and there, which are not easy to control each time they occur.
And while it might be true that COVID-19 isn't as deadly to children, we've still seen small numbers succumb to the virus, even here in South Korea. But what's the global situation like when it comes to children and COVID-19?
It's really unfortunate. We know COVID is generally mild in children, but it's not always the case. In the United States, they have 1 million COVID deaths. Only 400 of those are in children below the age of 5. And that's the age group where we generally don't have vaccines available. So it's really a concern. I'm not sure what the best solution is. I know that some of the vaccine companies are testing out vaccines in younger children. If those become available, that would be great. But it's really sad to see whenever a child dies of COVID. It's much rarer, of course, than the severity of COVID is much lower in children than it is in older people. So they're not the highest risk group, but still, it's really something that we have to think more carefully about in the coming years. And I do hope that vaccines will become available for young children.
Yeah, even here in the country, I mean, we've been getting, dozens of cases where the younger children have unfortunately succumbed to the virus. And it's tougher, like you said, when it comes to kids who are under 5 years old. I mean, again, no vaccines in place. Hard to have the masks on as well. So I guess all the more we have to be careful in that age group. But also more and more countries now opening up their borders with no quarantine for inbound travelers. Professor, are we ready to ease the travel restrictions already, though?
Well, I think so. I think in Korea, you face the worst that COVID has to offer. And so from now on, I don't really see a rationale for travel measures. What are they there for? What are you trying to stop? We know that when new variants arise in other parts of the world, it would be nice in an ideal world if you could keep it out of Korea, if other countries could keep it out. In reality, that's not going to happen. Once a new variant arises in another part of the world, it will find its way into other countries sooner or later, and travel restrictions have enormous economic costs. So those enormous costs may have been justified earlier in the pandemic as part of all of the measures that have been used to control COVID. But now, middle of 2022, I think there's little justification anymore for travel restrictions. And I mean the testing that goes on, the vaccination restrictions maybe. I don't think that's necessary. The post-arrival quarantines, whatever other measures are placed in different places, different parts of the world, they still have some of these measures in place. And I think all of them could go.
And Professor, there are more and more concerns about the so-called long COVID. I mean, what are the most common symptoms and how long do they actually last?
Still a lot of uncertainty about long COVID, and it's a big concern of many people. I think there are maybe three categories that we can talk about for long COVID. The first category is what people often think of as long COVID. That's the post-viral fatigue and brain fog that does happen in some people. It's not clear how frequently it happens, but it does happen. There's many documented cases, and it's really unfortunate because that is something we don't know how long it's going to last for and what the best way to achieve a recovery from that. So that's post-viral syndrome. A second problem is complications that result from the infection. And that's particularly maybe in more severe cases who've been in hospital, maybe who've even been in intensive care with a ventilator. Maybe they have some organ damage, maybe some other physiological damage to their body because of the infection. And that's something that they can recover from, but it takes time and it takes rehabilitation. And then the third category of long COVID is maybe the persistent symptoms, which may or may not actually be long COVID. So that's like people who lost their sense of smell or taste during their COVID infection and they haven't yet got it back. And so that's a persistent symptom. Those I think will resolve sooner or later, but it may take a bit of time for the body to fully heal. So it's the first one that we're most concerned about, the post-viral syndrome. It does happen with other viral infections. It's not unique to COVID, and it's something that we really have to understand better. One question is whether it's been happening as frequently with Omicron infections as it did in the past, and also whether vaccines have been able to reduce the chance of long COVID occurring. I hope that's the case, but a lot of the data that you see in the news in recent weeks will be data from earlier in the pandemic with different strains of COVID, maybe different variants, and also in people who hadn't been vaccinated. We don't have so much up-to-date data yet.
Yeah, I do have a friend who contracted COVID-19 more than a year ago, and still he hasn't gotten his sense of taste back, which was very concerning, to be honest with you. Probably there are other people that experience the same thing. Professor, as an expert in the field, what is your biggest concern moving forward? Because it does seem like, you know, with weaker symptoms and lower fatality rate with the Omicron, I mean, there are less people concerned about the pandemic. At the same time, really, you know, anything could happen with this virus.
Well, I really hope that we've seen the end of COVID as a pandemic virus and that in the future it will become a seasonal threat that we're more comfortable managing like influenza. But I do have a concern in the back of my mind. What if there's a new variant again, another thing after Omicron that really it causes a whole load of trouble again? But I think there's a pretty low chance of that happening because now we have such high levels of immunity in our population with vaccines and also with the infections that have occurred in the past. And also remember, we have antiviral drugs now, which are very effective in treating COVID. So I think we're in the best position we can be to move forwards in the fight against COVID. But for me, as an infectious disease epidemiologist, I'm always worried about what's next on the horizon. Is it another virus? I don't think monkeypox is a major public health threat at present, but maybe another virus will appear, and then I'll have to deal with that. I would actually quite like to have a bit of a break. Let's have some peace and quiet for a few years before anything else really serious happens. Thank you.
Well, hopefully even pandemics will go on a bit of a holiday, just to give us a bit of a breather before they come back. But, well, thank you so much for your insights, Professor Cowling, and we look forward to speaking with you again next week.
Thank you.